So as you know, we're not doing this alone, and this is an international situation of concern, and so the World Health Organization, the WHO, is actually leading the response internationally. We're connected to that via the country, via the federal government, and there's also a federal, provincial, territorial group of people meeting on a regular basis to make sure that we develop the tools that we need, that we coordinate our response, and that we also answer our questions together so that we respond in the best way possible. So British Columbia is part of that. And in British Columbia, we also have our system in place. So we have various working groups and various provincial groups talking on a regular basis, coming together and sharing guidance, answering questions, raising concerns, and identifying the next steps so that we can, again, be in the best place possible to respond to this the most effectively. BC has what we call a Provincial Coordinating Committee, and a few of us are part of that. And we connect with that PCC, the Provincial Coordinating Committee, and this committee has a number of working groups. And this is also becoming a whole of government response because many ministries are involved in the response. So the school system, for example, the municipalities, they all need information, guidance, and things like that. Now, at our level in this region, in Fraser Health, we have our EOC, as I mentioned, and we bring in people from various areas, the sites, and the various programs. So we have, when we look at this whole complex system, so we have access to good information, updates, tools, guidance, and a decision-making process that kind of helps us a lot in terms of doing the best thing possible to respond to this. So that's one. Also, over time, we have developed all sorts of good tools, information, and we've answered many questions from staff, physicians, and others. And that we created a web page, and we've posted all that information there. And so you'll see if you go on our main web page, there's a section for coronavirus. And then from there, you have subsections. And so there's a lot of good information there as well. I have sent a number of emails to all staff to inform people of the situation, give updates on different aspects. We also have documents and guidance that we send to our physicians. So we have a system to send alerts and updates to physicians in our communities. And so we have that as well. And these are also posted on our website under the Medical Health Officer updates. And you can find them there as well. Also on our intra-web, we also have information on the pulse. And we keep all the most current documents, guidance, and tools. And you have access to that as well. So we have, wherever you are, whatever role you play, we already have a lot of guidance, documents, and tools, and we continue to develop those if we need to adapt or create new ones as needed. So there's ample information, there's ample guidance, and together we can make a big difference. We have a lot of very simple things that we can do that will make a big difference. And there's some more complicated things, more technical things as well, and we do provide guidance on that as well. So hopefully you have all the information that you need. And if you have any questions, you can certainly let us know. And then if we haven't seen that question before, we will answer it. And we can put that on our Q&A website. And I just wish everybody to stay safe. And we need to all take care of each other and our patients. And that's what we're doing right now.